Hello and welcome. My name is Jennifer Cardellini from the Benjamin Rose Institute on Aging. Thank you for joining us today for Challenges of Aging for the LGBTQ Community. This program is a part of our series of virtual programs for caregivers that we provide each month. This program will be recorded. We will be sharing the link with all of you in an email next week, which will also be shared on the website, on the event registration page, and in our resource library. Please feel free to share that with friends and family who could not join us today. We have a lot of information to cover this afternoon, so we will hold questions until after the presentation. However, you may submit a question at any time using the control panel on the right-hand side of your screen. Before I introduce our speakers, I'd like to tell you a little about Benjamin Rose. We are a Cleveland-based nonprofit founded in 1908. Our mission is to support caregivers and empower all people to age well through research, consumer responsive services, and client advocacy. We provide a variety of services and supports to help people age well in the community. That includes behavioral health services, social work, counseling, and coaching to help people achieve financial wellness and housing stability. We also operate the Rose Centers for Aging Well, our senior centers located throughout the Cleveland area, and we are a Meals on Wheels provider. It is now my pleasure to introduce today's speakers, Tamar Cooper, Director of Behavioral Health Services, and Doug Braun, Behavioral Health Clinical Social Worker. Please join me in welcoming Tam and Doug.
Good afternoon, everyone. Thanks for listening in on today's presentation. So Doug and I will both be presenting, and hopefully we'll have some lively discussion towards the end. So Jen, if you'd give us the next slide, please. And Jen explained who we are from Benjamin Rose. So we'll skip over that slide. Next slide. And we'll skip over what we do. Next slide. And we'll just cover our subsidiaries again, because Benjamin Rose Institute on Aging really does have many facets. We have the Elder Care Services Institute, ESOP, Empowering and Strengthening Ohio's People, Rose Centers for Aging Well, as you heard earlier, our Margaret Wagner Apartments, which is a senior housing, and then our Center for Research and Education. Next slide. So I'm hopeful, and so is Doug, that at the end of today's presentation, you all will have an increased understanding of the gay and lesbian aging community and their needs, and you'll be able to identify some ways that caregivers and professionals can better help those in this community. Next slide. So aging and caregiving. Doug and I decided to do this presentation, one, because June is Gay Pride Month, and we wanted to recognize this community in Cleveland and throughout the nation. Discrimination of gay and lesbian seniors in the healthcare system has only recently begun to receive attention. Now, we hear a lot about younger adults, adolescents, but you typically don't hear much about older adults. Doug, we have a couple agencies, don't we, in the community, Cleveland, like SAGE, or could you speak a little bit about that, those two organizations?
Okay, sure. SAGE, it started in New York, and it stands for Seniors Aging in a Gay Environment. They have, last I knew, about 34 chapters around the country, and our LGBT center here in Cleveland has an affiliated SAGE chapter, and it probably would be a good idea to look at look up the LGBT Center on the web and connect with them. SAGE meets, with the pandemic, they've cut down the meetings, so they do some meetings in person and also some on the web. It's a social thing. They have Mondays and Wednesdays, they'll have lunches, exercise, chair yoga, and just a place for people to get together. And even if they're not doing something in the center, they'll still have get-togethers online. So I would actually,
There's also
that's probably the
another,
best
yeah.
organization.
Isn't there another organization too? And you can just briefly describe. Isn't there another organization too in Cleveland for the older adults who are gay, LGBT?
Oh, there's the social group,
Right.
Gray Pride. They have done potlucks every second Wednesday. Since the pandemic, they've sort of taken a hiatus. About 2 weeks ago, one of the members was asking me if we could start up again. And so, I said, I'm part of that group. So I said, get in contact with the other folks and see if they want to start up again, because I like to eat other people's food.
Great. So as you heard, there are a couple organizations in Cleveland that do provide some support for older adults that are LGBTQ. Now, caregivers for this community really do face a lot of issues because of the discrimination. Some of those factors are added isolation, loneliness, fear, increased discrimination, and lack of community support. So you can only imagine that during COVID, which did this to most every population, and particularly older adults, it doubled for the LGBTQ community. And practitioners face challenges too, responding to the specialized needs, and there are special needs and services for this community. Next slide. Doug, why don't you tell us a little bit about these?
Okay. Basically, homophobia is not wanting to be around gay people, thinking they're bad, being afraid, and heterosexism is it's the privilege. It's thinking that you're more privileged if you're straight. Heterosexism also, when the marriage licenses, were first created, it was man and woman, and now in Ohio they changed it, so that's good. One of the interesting things about where they come together, homophobia and heterosexism, is when I started work at Benjamin Rose, I had, I put a picture of myself and my husband on my desk. And somebody said, "Is that your cousin?" And her intent was to get me to say, "No, it's my husband, I'm gay." I figured she was not quite comfortable with saying the word gay, and so that's how she approached it. And so she wasn't sure what she should say, and I helped her to overcome that.
Now, both of you are considered older adults, right? You're both over 50, 55?
Yeah,
or
I'm
your
60.
husband?
Yeah, I'm 60. Brian is 65. I just helped him get onto Medicare and choose all that stuff.
So you can relate to many of these things here. Okay, next slide, please. So obviously in virtual presentations, we can't see the audience, but I'm sure that many of you understand and already know a lot of the challenges of aging in the gay and lesbian community. To begin with, there's a smaller support network. For as long as I guess any of us can remember, people are just not accepted by their immediate family. I mean, I think there's become an attitude where we're more inclusive of differences, but still it's been very difficult for a lot of people to come out to their families. And being gay, lesbian, there aren't that many children. So, your support system is smaller. And with that, there's been a loss of friends. A lot of people's support system was destroyed during the AIDS crisis. Now, I'm thinking about when things were going on in the West Coast, out in San Francisco and then out in Boston. But Doug, maybe you can talk about Cleveland area during the AIDS crisis.
Well, I came out in the 80s, which was the height of the AIDS crisis, and had way too many friends die. And when you think about, some people might say, oh, that was the 80s and 90s. That's a long time ago. Well, in a sense, yes, it is. However, people who were affected by that are now in their 70s and 80s, and they're still traumatized by that. And it's kind of interesting how AIDS is now a manageable disease, and there's also PrEP, which is pre-exposure prophylaxis, which is basically a pill you take every day to keep yourself from getting AIDS, HIV. So things have changed, but I'm on the cusp of the people who were traumatized, and that's still something we're living with.
And that probably fits in with the high percentage of people having an overlapping mental health disorder, because when you talk about being traumatized, clinicians would automatically think of post-traumatic stress disorder, right?
Mm-hmm.
Thinking of the loss.
A lot of those
Correct.
people have had a chance to assimilate that into their awareness and are not so traumatized anymore, but it's still something to think about.
And with that comes, when we talk about treatment for AIDS or sexually transmitted, now it's infections instead of sexually transmitted diseases, going to the doctor, not trusting doctors or even therapists. If it's not diseases, just to talk about your issues as a gay person, because you don't know how welcoming that practitioner is going to be, whereas most people do not have that concern when they call up to make a doctor's appointment or walk into a doctor's office. And one other thing I'd like to point out, which I thought was pretty interesting, community services. That's a great place for support for an older adult, right? Going to a senior center or community center. Well, if that community center is composed mostly of people that are, let's say straight, and you are going in there and you're gay and you haven't been come out yet, you're going into an environment where that's your only sense of support and you're still having to hide your true self. It's got to be really difficult to try and reach out to get a needed service when you don't feel safe. And it's a whole nother culture when back in the day, making jokes and being discriminatory about that culture, about that particular community of people was a lot more tolerated, if you will. So.
And I actually have a couple things to say about things like that. There was one community center, one senior center, where I found out that there was a secret Tuesday. Every Tuesday, gay people would go to that center, and they wouldn't acknowledge that they were gay. And this is 3 years ago, so it's not a long time ago. This is 3 years ago.
Wow.
I haven't kept up with it, but every Tuesday there would be a group that would show up at the center and congregate and talk together, be together. With COVID and things shutting down, I'm sure that's gone now, but hopefully it'll start back up. As far as barriers to LGBT folks getting services, getting help they need, there's basically three particular areas where those barriers come up. One is the individual themselves being afraid to tell their doctor, being afraid to say anything. So we can be, as gay people, can be our own barrier to getting help. And then, as Tam said, there's the therapists, the doctors, the nurses, and actually, I want to say a story about that. I had one client, and we used to take them to doctor's visits way back when. And one of my clients was a female to male transgender individual, and the doctor said, "Okay, we need to get you a mammogram just to check," because he was born female, and so the doctor said, "This is how your body is. We need to check it." So when we went to the scheduler and said he needs a mammogram, the lady looked at us and said, "A mammogram? He needs a mammogram?" And I'm thinking, okay, it's bad enough that he has to get a mammogram, and who knows what the results of that could be. But now to be embarrassed and everybody around her. So there's the individual themselves, there's the therapists, the professionals around, and there's also the organizations themselves. When you think, like on the intake sheet, does it say male, female? Does it say, well, actually, now we can get married, but in the past, how did you designate that? So things have evolved, they have changed, but there's still some other stuff that's remains.
Lack of sensitivity, right. Next slide, please. Thanks, Doug, for sharing that. Next slide. So, some of the rights that the gay and lesbian community has achieved. One very important one, that on June 26, 2015, the Supreme Court decision of Obergefell versus Hodges guaranteed same-sex couples in all states the right to marry and to have those marriages recognized at the federal level. This was extremely important and a landmark decision. Legal and financial decisions and documents that enforce them and the agents named in them determine who has the legal authority to talk with your doctors and make medical decisions for you, and to determine who has the legal authority to manage your financial resources and when you become incapacitated or legally unable to act on your own behalf. And this is critical. I mean, just across the board. Next slide. So some of the specialized resources, and Doug was talking about them, is the local area agency on aging. And you can call the elder care locator. It's a toll-free number. And when these slides, I guess, are going to be posted, you can get a copy of these numbers if you choose to. And there's the website for the caregiver.org Family Care Navigator. The Older Americans Act, which created a national family caregiver support program. It distributes money to the we call them Western Reserve Area Association on Aging, to provide services and contracts with community agencies to provide caregiver support regardless of who that person is that you're providing care to, gay, straight, whatever. And then also another really specialized resource is information on legal issues, or particularly employment issues. FMLA, go to Lamba Legal, which is www.lambalegal.org, or the National Center for Lesbian Rights. Again, the website, and you can check that by looking at our slides a little later, or you can contact us back at the agency if you choose. Next slide. Doug?
Well, we actually have one other important organization I forgot to add to the list. That's Equality Ohio. It's a statewide organization here in Ohio, and they do have a legal clinic. They're a rights group, but they also have a legal clinic in case LGBT folks need to have an attorney for some reason. And one reason I can think of is to get in Ohio, it just became possible to correct a birth certificate. So if an individual is transgender and they have and they've gone through the legal process of changing their name and everything like that, they can change the marker on their birth certificate to say whatever their real gender is. That's a good resource, and it's just Equality Ohio. I mean, it's not that hard to look up. Their services are free, and so that is one of the important things we have here in Ohio.
That's probably important for case managers too, when you're working with older adults who are, finally coming out and trying to live their true life, to make some of those changes that you as a professional can help them with.
Yeah, and I was able to help someone correct the marker on their driver's license. He was in a car accident. Some 17-year-old hit him, ran into him, and when the police came, they said, "I need your driver's license," and they looked at the license, and they looked at him, and they looked at the license, and they said, "This is a woman." And so it was a big, a thing for him. It's just one more slap in the face he had to go through. So I was able to, with the help of a psychologist, to change that. Now, one thing is interesting for transgender people, from my perspective, is you can change your name, you can change your birth certificate, you can change your driver's license, but the health insurance still has to say whatever your body was born as. And so that's so that things like mammograms are covered. And so other things, it's still not perfect, but Metro was the first in Ohio to create an LGBT clinic, and I know Cleveland Clinic is trying to work on that. I haven't kept up, but there is an actual LGBT clinic that anyone can go to at Metro. Anyone can go there, but it focuses on the needs of LGBT folks.
That's good to know, because there are so many things besides, on the driver's license, getting social, when the time comes for Social Security benefits, verifying who you are and whether you are a man or a woman. There's just so many complications that you have to go through. Next slide, please. All right. Well, the time to talk is now, not then after it happens. So by 2050, almost 21% of the population is estimated to be over age 65. So the LGBTQIA plus population, and Doug will later say +2, +3, +4, is estimated to be about 10%. There are legal protections and limitations that need to be talked to among caregiver and the person that you're caring for before someone becomes incapacitated. Because if you do not have legal documents, and we'll touch on those in a little bit here, and I know we're running on time here, it just doesn't exist. So because incapacity can happen suddenly, a stroke, a car accident, COVID. Doug, do you want to kind of quickly tell a story about your friend that?
Okay. Well, actually, this is a straight couple, a man and a woman. They didn't get married, they'd been partners for, I don't know, 15 years. They were my neighbors. And the woman had a stroke. And they did not have power of attorney papers. So they weren't married, so they had no protections that are given by being husband and wife, or husband, by being married. And the family wasn't real pleased with their relationship. So there was kind of a struggle for the guy to actually have an impact on her care. I mean, he knew what she wanted. They had been together 15 years, but the family was an extra piece in there. And if they had had power of attorney papers, and you don't have to get married, you have to make sure you cover yourself. And power of attorney papers are a big part of that. And there's a number of other documents you should have. And really, you should talk to a lawyer, because I'm not a lawyer. I can say what I think you need, but a lawyer is really what you need. And so if you are a caregiver for someone who's married to someone else, I'm sure you're working with the partner. But if you're working with an individual who is not married, make sure that you have the power of attorney papers for health care, so that you can be recognized as the person to make the choices, and just protect yourself and protect your loved one, the one you're caring for.
Okay, next slide, please. So some of those documents include a will, which is a legal document that allows you to designate who will receive your property and how when you die. The laws of, now I'm going to pronounce this wrong, intestacy in the state in which a person lives determines who gets everything unless there's a named beneficiary on the asset, or if the person held the property in joint tenancy with another or in trust. And we've all heard of problems, with the will when someone passes away, if somebody else is named or not named, and there's a will contest. The same-sex partner or friend not named as a beneficiary in the will, even if they've been together for forever, will not receive anything. And they can contest that will for all they want, but if they have not been named, then it's a tragedy. They could wind up finding that everything belongs to the deceased goes to the biological family members against the deceased's intention. Next slide, please. Quickly, Doug, do you want to describe what a durable power of attorney is for property and finance, and durable power for healthcare?
Basically, it's assigning someone to be able to make choices on your behalf. It doesn't mean you're giving up any rights. It just means this other person has been approved by you to make certain choices. And they can be financial, they can be limited to only selling my house. They can include absolutely selling everything. They can include making arrangements for long-term care or in a nursing facility. And the power of attorney for health care is a special one which pertains to medical needs. If I become incapacitated, what do I want? Who do I want to make that choice for me? So that's what the power of attorney for health care is.
Yeah, things like it says, end of life care, funerals, memorials, and the like. Next slide.
Yeah.
So just some important resources to keep in mind, and for everybody to know where they're at, and to really look at, don't just do them once, 25 years ago. Keep abreast of these things as things change in your life. Deeds to houses, properties, insurance policies. Maybe you were married once and had an insurance policy made out to somebody else, and you're divorced, and you've got, this insurance policy that was made, someone else a beneficiary. You might want to take a look at that. Financial accounts. Check the estate plan for long-term care insurance and disability insurance. Doug talked about the Transgender Law Center. Here we go. Lambda Legal. There's this National Academy of Elder Law Attorneys. And then we very early on talked about SAGE. There's a national hotline and an elder hotline. Next slide. And again, some local resources. The Metro Health Pride Clinic, phone number and website. LGBT Center of Greater Cleveland. Tai Chi, discussion groups, lunch programs, and more. It says Equality, Ohio Legal Clinic. Doug, you were right. There you go. Helps correct gender markers on driver's license, birth certificate, power of attorneys, or will. And then, of course, Benjamin Rose Institute on Aging. As you heard Doug speak, he's been one of our senior members on our behavioral health team, works with a lot of LGBTQ clients that come in for counseling, case management. We're here to help. Next slide. So you can see here that if anyone is interested, you can certainly call our intake number, which is 791-8000, and ask for intake to talk about any mental health needs or questions. But right now, we'd be willing to answer any questions that you might have.
Thank you so much,
Pam. I'm now going to pass it over to Julie Hayes to go through our questions.
Thank you. And I encourage anyone who has a question but hasn't asked it yet to submit a question using the bar to your right. But to start, our first question is, how can rural area agencies on aging assist LGBTQ seniors? How do we market services to them?
Well, marketing services, I think so when you talk about rural areas, you might want to first see about getting support from your local ADAMIS boards to see about initiatives. I think that you can work with the local agencies to talk about and do presentations, just like we're doing. What's available? What's the community makeup like? Because rural communities, I live in Geauga County. We have a large Amish community. We have a lot of older citizens. Providing information, because information enlightens people and they're not fearful. So that's how I would start. And just letting people know what's available. Wouldn't you say, Doug? For starters?
Well, yeah, I think that in your materials, make sure you say, people usually in their materials, they'll have that little phrase at the bottom saying we don't discriminate against this list. And if you put LGBT in there, we will recognize it as we LGBT folks will recognize it, and we will tell other LGBT folks. Now, as far as actually a marketing plan to catch all the LGBT folks in Lorain County, you're not going to be able to directly get to them. You have to be indirect. So that's why I said through the marketing materials. That's really how, I grew up in southern Lorain County, so that's the only way I can see reaching that community, unless you run into some enterprising college student who wants to do his master's thesis or PhD on LGBT seniors. So,
good question. I think those are some of our suggestions. So, and feel free. I don't know who you are. you can certainly call me if you'd like. Call our agency and ask for Tam Cooper, and I'd be glad to talk with you further.
Thank you so much. So our next question is, what would the presenters consider to be ways or approaches to make services feel more inclusive to LGBT plus individuals, such as combating individual factors like fear, apprehension, etc.?
Don't assume someone is straight. And what I mean by that is, if you're interviewing an older gentleman and he's never been married, or maybe he has been married and now he's divorced, I mean, you can't tell. I mean, you don't know. Don't say, so, okay, so is there, do you have a girlfriend? Don't say that. Say, is there someone special that you care about that we should be, you know, like an emergency contact, we could put them down. I was doing an interview to do an intake for an older woman, and her daughter was there, and when I arrived, her daughter's friend left to play tennis. And I saw a church bulletin on the side, and I knew that was where a lot of gay people went. So I said, oh, I know people there. And that's how it opened up for me, for that relationship, for that client. Just when you say things, be conscious whether or not they can be construed as being limiting to being straight people.
I think too, many agencies now are doing a lot of training on discrimination, equality, and inclusiveness, and being able to make sure that your employees have a thorough understanding of different issues and being able to use the right language with the LGBTQ community. I was using the word lifestyle for a while. Well, that's not the correct word, and that can offend people. So educating yourself, if your agency isn't, being careful, and Doug made an excellent point, you know, don't assume anything.
And if you have people come into your office, have like a little gay flag, you know, in with some other stuff. You know, put signs around your office that you're accessible and you're open.
Good idea, Doug. Next.
All right, some great points. Thank you. So you mentioned in your presentation about how there tends to be more conversation around young adult or adolescent in the LGBT community. So how can we strengthen intergenerational relationships and support networks for LGBTQ plus older adults?
You know, now I'm going to speak for myself. There are differences, but I think there's a lot of things that are just alike. You know, how do we strengthen intergenerational discussions with straight people? You know, let's bring people together. Let's have community events. Let's have sessions where we offer opportunities for adolescents to meet with the older adults who are gay, to, you know, this is Gay Pride Month. What a great opportunity to sit down with people who've been through, you know, the different landmark decisions and milestones and events to learn about history and what this means. Just bringing people together and community activism. It's community advocacy, whether that comes through an agency or places like SAGE or the Great Pride Initiative, or someone offering it through another opportunity. You know, well, hopefully once we get out of COVID through a library or something. What do you say, Doug?
Well, I think since this is LGBT Pride Month, it would be a good time for every organization to start thinking about how we can include everybody, but also the fact that we have these resources like our Cleveland LGBT Center. I mean, it's a wonderful resource. And they also do presentations, and they can educate folks. They have their senior group, they have their youth group, they have all kinds of groups, and Equality Ohio, different churches have some outreach or an inclusion. It's one thing to be outreach to, thank you for outreaching to me, but I'd rather have you include me. Okay. So actually ask the LGBT folks in your organization what your company, your agency can do, because they'll be a good resource, because they'll be able to tell you, we really are not good at this, but with this thing, yeah, we're doing okay. So use the people you have, the resources you have within, to make yourselves even better.
And I like that. Thanks.
All right, we have time for one more question. So with a higher proportion of LGBTQ older adults living alone, are there any specialized programs or resources to help them age in place?
Oh, you know this answer, Doug.
There is no
Deep breath.
There's nothing official that I know of. Now, I do know that LGBT Center here in Cleveland has been talking about like a senior companion group or something like that. So if there is anything, they would be the people who actually know the answers to that.
Thank you very much.
Wasn't there a
Thank you all for your. I'm sorry, Tam. Go ahead.
That's okay. I just thought that there was a small apartment complex maybe that was for LGBTQ.
Well,
but I might be wrong.
No, you're right. It was initially conceived as that. For a lot of reasons, it's not. I mean, it's still there, and there are still gay people who live there, but it's not the place that the visionaries thought it would be. It's just like another apartment building. So
that's something that's being kind of worked on as a project, anyways, to help people age in place. And I like this concept that you said of maybe a senior companions for gay and lesbian community. I like the older adults.
Yeah, that's actually something I thought Benjamin Rose could do, but I knew if I brought it up, I would be the one who had to do it. Maybe we can work together with the center. I think that would be a good way to do it.
Okay. Thank you.
Well, thank you so much, Tam and Doug, for your presentation today. And thank you to all of our audience members who asked great questions. We really appreciate that you joined us today for this program, and we hope that you will join us for future virtual programs for caregivers offered each month. So please save the date for our next program on July 7th. More details and registration will be available soon on our website at www.benrose.org. Thank you, and I hope you have a great rest of your day. Take care.
Thank you. Thank you very much. Bye-bye.
Bye-bye.